Howdy, howdy. We'll wait for people to show up. Just living life here in Jersey.
Back in Jersey. Hi, everybody. It's been a while.
It has been a while. Yeah.
It has gone from winter with the fire to summer with the door open.
The door's open. There are deer in the yard. There's
Baby
even
deer.
a fox. Yeah, so I flew into Newark last night so that we could do this before I have an event this weekend. And the last time I saw you was actually at New York Baby Show.
And that was a good time.
That was a great time.
We had an awesome
Cheers. It was very good. We got to do it live.
That was the first time
And
we did that live like that. And that was super fun.
It was very fun. And we'll be doing that again in Austin very soon.
We will.
Austin MommyCon.
Here we come.
In case any of you didn't know, surprise. So thank you for the haircut compliment. Yes. I am having a Pinot Noir. She is having water.
I already had some wine, but if I keep on doing that, I won't be able to answer these questions the way we need to tonight.
Or maybe just the way we need them.
That's exactly what we need tonight.
So while we're here, really quick, go ahead, go like Shari's page. I tagged her. Make sure you're liking Evenflow just because they have allowed this to happen for the past year and a half that we've been doing this. And without them, this would not work out. So, y'all all know me, hopefully, which is why you follow my page. So I always let Shari give a little intro to herself, talk about her background. On a personal note, I forget how many years I've known you yet.
It's
now.
like 7.
7?
Yeah, something like that.
7 years, something.
Yeah. Long time.
Yeah, I've known her for quite a bit, so it's a good thing. So
you can't really say that so much in this, in this industry that we've known each other that long.
Yeah, I've known you a long time. Almost as long as I've been in this. I wasn't at Bye Bye when I met you. I left Bye Bye
right
at that
after
point,
that.
It's been.
It was like right when all this was
been
started.
a bit.
It's been a long time. It's been a long time. It's been like family now.
Yeah.
We've slept in each other's houses enough
times.
Yeah,
it's the truth. It's the truth.
So for you guys who have not met me or have not seen our prior live shows, I'm Shari Criso, and my background, I've been working with moms and babies and dads delivering babies for 25 years. I was a labor and delivery nurse. I was a nurse midwife for many years. I delivered 600 babies in my practice. My phone's lighting up. That was one of them. And then I had a specialty retail store in New Jersey, which is where we first met, and a web TV show back in the day when web TV was not very easy to do.
No, back before it was an app.
Before it was an app. And so that's how Jamie and I found each other, coming into Jersey to do the show together, and also a international board certified lactation consultant, and I work with Evenflow Feeding. I actually helped to develop the new Evenflow Feeding Advanced Double Electric Breast Pump, which is how we started doing these Q&As together again and got back together. And now I have online breastfeeding classes, which are included in the pump, and I also have them on my website. And
let's just reiterate that. Let's repeat that. When you get the Evenflow pump, it comes with her online classes.
Included.
There's one about pumping and there's one about breastfeeding. So that's a very good thing.
It's a great thing. Because you know what? You need the education. Just like we're going to see tonight. That's why we're doing this.
Yeah, that's why we're here.
Products are good, but you need to know how to breastfeed. So we do both.
Yeah. So we have some questions. We'll just get right on into it. We're going to take some questions that were left. We will also take questions here as you type them. So
I have my contacts in and I can't see good with them, so you're gonna have to read.
Listen,
everything
I've nailed this. I've nailed this whole
It's really
I'm paying attention to you, but I'm reading the screen. That's which is why I will always lean in. I have a little clip. I have a clip lens on my phone that's a wide angle, so that we can actually get both of us. But that means I have to put the phone a little bit further away. So I'm like.
Yeah, I can't see anything, so I just see the thing moving. So I'm just assuming you're all there, and hello.
Here we go. I know you say that 4 to 5 ounces of breast milk is normal for a baby, but if my baby is taking a bottle every 4 hours and sleeps through the night, he only has around 3 bottles a day. She takes 5-ounce bottles, so that would be only 15 ounces total for the day. Is this enough? He's almost 9 months and has 1 container of baby food for breakfast and then 2 for lunch and supper. I just don't want him not getting enough breast milk. I exclusively pump.
Ah, okay. So what she's asking is that her 9-month-old is taking only 3 bottles a day instead of more, and just wondering should the baby be getting more bottles a day since she's an exclusive pumper. This is where it becomes really challenging, because if you were breastfeeding at the breast, like nursing at the breast, you really can't tell how much they're eating. And so where moms who are exclusively pumping start to have challenges is, are they getting the right amount? They're sort of having to determine that. What I would first of all say is that usually I know she said that I recommend 4 to 5 ounce feedings. Typically, a breastfed baby that nurses at the breast is going to eat somewhere more around 3 to 4 ounces at a feeding, not 4 to 5 ounces. And this, of course, is who knows, because you can't see it. But that's the typical amount. So I would say 15 ounces, if it was a 3 or 4 ounce feeding, you're talking about 4 or 5 feedings in a 24-hour period, not 3. And so the baby's just getting more at that feeding. The baby's also eating solid foods. 15 ounces at that point, I would say, is fine. And main thing you want to do, I think, because you really don't know how much is the exact right amount, is offer the breast milk first, just the way you would when you're nursing a baby. Offer the breast. If you're nursing at the breast, you're going to offer your breast first, then offer food. Same with the bottles. You might want to offer a little bit less in the bottle and a little bit, and space the feedings out a little bit more, like the solid food. So or if it's working where the baby's getting 5 ounces in a bottle and then eating a meal where it's just solids in the next feeding, that's fine too. But the answer to her question is yes, that's enough. And who is that asked that question?
Already scrolled way down.
Okay, anyway. But yeah, that's fine. Probably just getting a little bit more. One thing I would recommend is to try not to overfeed. Because babies can, Lucky likes to be overfed too. Babies tend to get overfed with the bottle because you can just keep pouring it in. And so you really want to pay attention to your baby, pace the feedings so that you're watching your baby's signs to see, are they falling asleep? Are they really eating vigorously still? Or are they kind of just moving their mouth up and down and stop?
Fair enough. All right. Katie wrote this on your wall and on mine.
Okay, so she really wants to know.
I took note, Katie. Shari, I have a question about pumping. I find that sometimes my nipples lose circulation during pumping. They are white when I remove the flange. I've tried different size phalanges, flange placement on my breast, suction strength and speed. I have the even flow, but nothing has seemed to help. Also, most times I'm able to hand express about a ½ ounce or so of milk from each breast after pumping, even though the flow of milk has stopped before turning the pump off. Suggestions on how I can more fully express my milk without having to hand express as well? Thank you.
Well, the first thing that comes to mind is that the flange, it might not be fitting properly. Especially, and the reason for that is not so much the white nipple part of it, but the fact that she's not emptying the breast with her pumping, so that she's able to express more afterwards. Which is common, that happens. The pump can't always get out all the milk, but she's struggling. So first of all, she's having pain with pumping. Her nipples are turning white and blanching during the session, and she's not fully expressing. I would say the first thing is to really try to make sure that those flanges are fitting properly and that they're not too small.
Deer. They're even baby deer.
Little tiny ones like this big. We have to get them on camera. The other part of that is there's something called Raynaud's, and it's not just with pumping that you'll see this, but moms are going to know what I'm talking about, some of them. This is something we've not talked about, but what it is, it's a vascular issue that some moms have when they're breastfeeding, where after the feeding, their nipples they blanch white, and all the blood kind of drains out of the nipple. They can get very painful. It can be very painful. And so moms experience like real pain and a blanching of the nipple after a feeding.
Really?
And it's a vascular constriction so that the blood's not flowing to the nipple at that point. One of the things that you can do that really helps with this Raynaud's is have like a warm compress available so that right after the baby unlatches, you put the heat right to the breast, and that's going to help with the pain and the vasoconstriction that happens with this situation. So that could be going on too. That's a very typical sign of Raynaud's when you see the white blanching of the nipple.
Well, I certainly had never heard of that. You learn something new every day.
Is anybody experiencing that? Because a lot of moms do have this. It's like a pain. You'll have like a severe pain afterwards and whiteness.
It definitely sounds not awesome, Randy. I would say.
No, it's not awesome. It's not awesome, but it's common. It's really not that uncommon.
Huh.
Warm compresses.
Yeah.
Warm compresses. There's not that much you can do about it.
Yeah.
It's not like, an infection that needs to be treated or anything like that. It's just more of a vascular situation.
Fair enough.
And so I think she might be having that with the pump, but that could be it could be the wrong flange size, or it could just be pumping in general.
There we go. I hope that helped.
Joe said 3 people have said that they do have that.
Interesting.
Mm-hmm.
And some people know people that have it.
Yeah.
Huh. I've never heard of the white nipples.
White nipples.
Fair enough.
White nipple syndrome.
White nip syndrome. It's like we call, mastitis, we call the boob flu.
Yeah.
Everything needs a fun name.
Yeah.
You have to be able to laugh at pain. So Bera Lucia, I hope I pronounced that correctly. Hi Shari, I was wondering if you can give me some suggestions for avoiding choking while breastfeeding. My little girl's 2 months old tomorrow.
I thought she was choking during breastfeeding.
She's like, it's bread.
Don't eat and breastfeed at the same time. You won't choke.
She's 2 months, whatever.
I was like choking.
My little girl's 2 months old tomorrow, and we are both getting very frustrated while nursing because she's constantly choking on milk and we need to take breaks. I have to change after every feeding because I end up with breast milk all over me. Mm-hmm. Thanks in advance for your help.
Well, obviously you're making lots of milk because first of all, you're ending up with the breast milk all over you and your baby's choking during the feeding, which indicates that you have an abundance of milk and probably a pretty heavy letdown, which means that when your baby first latches, your baby's choking because
they're getting a
mouthful and they can't control the flow. A couple things with this. Depends on how old your baby is. Sometimes right in the beginning, like when you're still engorged in those first early weeks, this can be an issue. For some moms, it can continue throughout breastfeeding the whole time because of oversupply or just heavy letdown. One thing that could help is, to take the baby off after a few seconds of nursing, allow the flow, keep a towel and express some into the towel so that the baby's not choking on it. Feed in a position where the baby's more on top so that the milk can run out of the mouth versus underneath you where the baby has no control and it's kind of going down their throat and they're choking on it. So more of a laid back nursing with the baby on top can actually help a lot with choking. And then if there is a cause for the oversupply, deal with the oversupply issue. So if you're pumping extra, if you are, overstimulating the breast, and that's causing that oversupply, which we see so often with moms, sometimes just because it is, and sometimes because it's caused. If you're causing it from a lot of extra pumping, that could be the reason. That will help the choking. And let me bring up something else too about that. Make sure that you're stopping frequently to burp the baby, especially if you have that kind of a heavy letdown. So think about when your baby latches on and the baby starts nursing in the beginning and you hear that loud gulping. That's that heavy letdown that's happening and the baby's gulping and gulping. And imagine you drinking, something, drinking water, drinking a soda, drinking a beer, whatever it is, drinking your wine, okay? And you're gulping. If you were gulping something, you're swallowing a lot of air. Yeah. To keep that in mind, so when you're hearing a lot of that gulping, you actually stop the baby and do some burping, even a minute into the feeding, if you've got that heavy letdown. Because once that air bubble goes in and you keep putting more milk on top of it, that bubble needs to now travel all through your intestines. They're going to be more gassy. They're going to be more fussy. You just need to burp more frequently through the feeding.
Do you want to show some good burping techniques?
Yeah, we don't have Angry Baby, do we?
I didn't bring Angry Baby.
We can have Lucky. Give me Lucky.
Where's Lucky? We're going to burp.
Did you get him?
We're going to burp a tiny dog.
Yeah.
Where is here? Oh, here he is. He was at my feet.
Take off his thing.
Take off his. No, listen. Lucky likes to hump my foot for some reason. He just likes to sit on my foot every time. Every time. Oh!
Okay.
Hi,
All right.
Lucky.
Lucky, we're going to burp you. Okay. So, the best way to burp a baby... See, oh, my baby. Hello. Hello. Are you really doing this? Okay.
Yes, we are.
Okay, so you're going to hold your baby like this, okay? And underneath their chin and their chest, you hold them, and you're moving them up and down. He likes it. See?
There's no judgment.
Okay, you move him up and down like this. And the movement, actually, in a real baby, not a dog baby, in a real baby, he's wagging his tail, so he's still happy. A real baby, what you're doing is you're actually keeping them calm. And so it's not about patting them really hard. It's about keeping them from crying and keeping them awake. So a baby needs to be awake and not crying in order to burp. They don't need to be patted. So like when you need to burp, I don't need to do that. You just need to straighten out.
Yeah.
You need to relax your body, relax your
So it can
diaphragm.
come out.
Exactly.
Yeah.
And let the air come out. I'll let you down. Here. Joe, take him. Because he's stuck up my sweater now.
Is he quiet?
Oh, he's totally stuck. Hold on.
We are so special.
Okay. Here, take his thing here, Joe. All right.
There you go.
So you're holding the baby sort of under the chin and holding your baby's bottom and under a pinky under the arm and moving the baby up and down like this is really the best way to calm the baby. Babies like movement, and that keeps them really calm. You'll see they kind of go into this like trance where they calm down, and if they're not calming down because you've taken them off the breast, they may be a little bit angry that they just got feeding and maybe it's only a minute into it and you're saying, I hear a lot of gulping. Some people need to burp their baby 6-7 times during one session of feeding. So if your baby's screaming when you take them off, one thing you can do is when you're moving the baby up and down is to shush really loud in their ear. Shh. Like this, and the baby will actually calm down long enough to let a little burp out. Sometimes the burp's not loud, so having your hand on their chest where you're holding under their chin and your palm of your hand is on their diaphragm, you can actually just feel the air. So, and then you're done and put the baby back on.
Fair enough.
We don't have a doll, so
We don't
unless
have a
Joe
doll
can
right
get a
now.
doll. Yeah, get a doll. We'll bring it out in a minute and I'll show you for real. Not with a dog.
Rosa has a question about the boob flu. I got the red streak yesterday evening and called my doctor this morning, and she called in a prescription for dicloxacillin.
Dicloxacillin.
Sure. This will be my 4th round on antibiotics in less than 3 months. I really do not want to take any more medicine. What will happen if I do not take the antibiotics? Will the infection get worse? Can the red streak go away on its own? I do not have any hard lumps, only the red streak. I'm not in too much pain. I just feel a little run down. Is it typical for a nursing mom to have 4 mastitis infections in 10 weeks? Any insight would be much appreciated. Thank you.
Oh, okay. So mastitis is a question that keeps coming up a lot, especially on my wall. Like a lot of my moms, and I think I had already answered this question, but I'm going to answer it for all of you. Mastitis as a condition is actually an inflammation of the breast tissue, not necessarily an infection. So there's infectious mastitis and there's non-infectious mastitis. So not all all mastitis is going to turn into a breast infection, which means that not all mastitis requires antibiotics. That's very important because typically if you call your physician with any kind of redness or pain in the breast, the first thing they're going to do is just prescribe antibiotics. And this is why people are on multiple doses of antibiotics and then wind up with the antibiotics causing thrush and then causing more infections. So it's very important to understand the difference between mastitis and a breast infection. And typically they are used synonymously and they're not. Okay, so what I would say is that for mastitis, which can be that inflammation, the redness, you may get a fever, you kind of feel pretty sick, you have pain in one breast, the red streaking that she's talking about. Typically the first thing to do is to try to use non-medicated techniques or like warm compresses to the breast or soaking the breast in water or taking a nice hot shower, massaging the breast, feeling for any plugged ducts that may be causing it, lumps in the breast. emptying the breast frequently, so feeding a lot on that affected breast. There's no infection that the baby can get from doing that, so you want to continue to keep on feeding or pumping on that breast, because keeping it empty is one of the ways that you're going to treat it. I usually give it 24 hours, about 24 to 48 hours. If the fever's coming down and the symptoms seem like they're getting better, then there is no need for antibiotics, okay? But if you feel like you're getting sicker, you're doing all these things, and your fever is going higher, or you're getting your symptoms are getting worse, then yes, at a certain point you will need to start a course of antibiotics and then finish the whole dose, because you can end up with a breast abscess and other worse complications. So, but I think that mastitis is really overtreated, and antibiotics are not that benign. So, and treating can actually cause more infection. So I would say, if you wind up taking antibiotics, make sure that you're taking a really good probiotic at the same time. Taking the probiotics actually has been shown to help reduce overall infection anyway.
Okay.
So taking a probiotic, people really should be taking probiotics all the time. I take probiotics every day. So taking probiotics, but especially if you've had any antibiotics in labor or during your delivery, and especially if you've had any while you're breastfeeding.
This is kind of related, but a lady just popped up. I'm having surgery where I will be put under, and they said I can't breastfeed for 24 hours. Is this correct information?
No, it's not correct information. And my neighbor, actually, and friend of mine, just had surgery and was calling me from the recovery room because no one had told her that she couldn't breastfeed, and then as she was waking up, they're like, you can't breastfeed, and she's got a breastfeeding baby. This is completely inaccurate information, and it's widely spread among the medical community that anesthesia is contraindicated for breastfeeding, which it's not. As soon as you wake up and you're conscious enough to hold your baby after anesthesia, it's safe to breastfeed. Those drugs that they give you to go under general anesthesia are very short acting, very short half-life drugs. They come in and out of your system. That's why you wake up.
Yeah.
Okay, so they come out quickly, and so that's not enough of a drug to actually be in your system enough to pass to your baby to be a problem. So you do not need to pump and dump. You do not need to avoid breastfeeding. If anything, what you're going to do is you're going to wind up causing, milk engorgement, and then wind up with a breast infection. You're going to cause all kinds of problems. So none of this is true. And if your doctor's insisting, what I recommend is, just go online and Google Thomas Hale, mother's milk medication, look on Kelly Mont. There's so much information about this, accurate information. And the problem is that anesthesiologists and a lot of times, physicians in general are just not knowledgeable about what's safe to breastfeed, like what medications are safe with breastfeeding. And so it's always like, just don't do it. But that's not a good answer, because breastfeeding is super important, and you don't want to interfere with it.
Great.
And most medications are safe to breastfeed with, by the way.
And that also brings up something else really quick. Someone asked how this wine is. The wine is delicious. And somebody said pump and dump after drinking alcohol. Is there a rule to follow?
You really don't need to, unless you're planning to get bombed. So yeah, let's put it this way. Just like we were talking about medications, let's say this: everything, the medications, most medications, alcohol, that will go into your breast milk. So you'll drink, it does go into the breast milk. But what winds up happening is, given time, as time is going by, just like your blood clears out the alcohol, your liver clears it out. The alcohol is also cleared out of the breast milk. So it goes into the breast milk, but then it comes out of the breast milk. That milk is not ruined. Yeah. Okay? So basically what you need to know is that you need time. So it's the quantity of alcohol that you're drinking, and then the time between the drink and the next feeding that's really going to be important. The rule to follow is, if you feel drunk, then don't, okay? Because if you feel drunk, or if you're feeling the effects of the alcohol, it's probably too much in your milk. And at that point, then you either can hold off. If you're pumping, you can hold off for another hour and then see how you feel, and then pump. If you're with your baby, then maybe you want to give some stored milk that you pumped earlier. But yeah, you don't want to drink to the point where you actually feel the effects of alcohol and then breastfeed your baby. Your baby will get it.
Yeah.
But no, most people do not need to dump milk. The best time to drink, if you're going to drink like a glass of wine, and for most moms, when we're talking about it, we're talking about like one drink. I mean, you've spent like 9 months not drinking during pregnancy. One drink's going to be a lot for a new mom, okay? So they're not going to sit there and drink after drink. So the best time to do it would be like right during the feeding, like so you're nursing the baby, and
right after,
or immediately after you're done nursing the baby would be the time to have the drink. Because now you've got a 3 hour stretch till the next feeding, which is plenty of time for that alcohol to go into your system and then out. That also is going to depend on your body weight and your tolerance and all that. So if you're really tiny, it might only be a half a glass of wine. If you're nervous about it.
But enjoy that half glass.
But enjoy that half, and you will. And you will.
Enjoy it.
You know, the one thing that you can do, and people ask about the alcohol strips. You know, those strips. The only time you ever would really need something like that is, say you're going to an event, like you're at a wedding, or you're somewhere where you may be having more than one drink and you're pumping while you're gone from your baby. Those can be good for testing, just to tell if it's the right time to pump or not, if you've waited long enough.
Yeah.
So like if you had it like a drink or two and then you go to pump, you can test the milk and see, oh, the alcohol level's too high, let me go dance for a little while longer, and in a half an hour I'll try again, and then when the milk is testing negative, you can pump that.
Look at that. Somebody just asked about all the stupid thumbs and hearts flying across the screen. That is because I think they're kind of fun.
It's the only thing I could see.
But let's just know you're here also. But Facebook lost their mind and decided to make that a little bit more interactive, like Periscope. I have mixed feelings about it, but I think it's kind of fine. This is interesting. How can I up the fat content of my milk? My little one is not gaining. She is exclusively breastfed and will gain a couple of ounces. Then we go back to the second weight check of the week, and she's lost all of what she gained, if not more. She was born at 9 pounds 6 ounces and is at 11 pounds 8. We feed every 2 hours. Doctors let us try everything possible and is now highly suggesting formula. My other two were breastfed until 18 months and 15 months. Since 2012, I've had a total of 8 months not breastfeeding. Has my body just had enough?
Okay, well, my question is, how old is her baby? Did she say?
She did. Hold on. She's...
I want to know why.
No.
Okay, first of all, I'm going to assume young. The baby's 11 pounds.
Yeah.
Right? Okay, maybe 2-month-old, I'm assuming, right? First of all, I don't know why they're weighing the baby more than once a week. Okay, so if you're going for constant weight checks, and if that baby was born at 9'8" and is now 11'2", and I mean, it's really hard to tell because I don't know if this baby's 6 months old or 2 months old and how much weight has actually been gained. But pretty much, let's answer it in a general way because I'm not really sure about her specific situation. But the first question was, if I remember, was can you increase the fat content of the milk? And the answer to that is no, not really. The fat content of the milk is more of a genetic thing. So, and it really does vary from baby to baby too. So it's, you know, with one baby you might have a higher fat content to your milk than the next. From one feeding to the next, the fat content could be higher or lower. And I've seen moms who, they're feeding fine and their volume, like the quantity of milk that they're making is fine, but their baby's not gaining. They're not losing, but they're not gaining. And they're kind of like just maintaining, and they're like, what's wrong? You know, there's plenty of milk, baby's peeing a lot, there's definitely enough volume, and it could be that the calorie content is not there. That could be causing the baby to not actually gain. These are rare situations, and I've seen it in my practice, and it takes a time, like, you know, almost a month's time to even identify that as an issue. Yeah. But over time, you can sometimes identify it, and one of the things that you can do is to, you know, before even the supplementation, is to pump at the end of a feeding where the fat content is a little bit higher and supplement with your own breast milk at the end of the feeding. So that gets into foremilk and hind milk situation. The beginning of the feeding, there's more watery milk. The end of the feeding, there is more higher fat milk. And so pumping out some of that extra fatty milk and feeding that to the baby could be a solution. Some babies actually do need some formula supplementation to get them through that period if the fat content of the milk is not there. Again, it's a really, it's not a common situation, and it doesn't mean it's not going to change. Like, it could be like that just for the first month, and then a month into breastfeeding, your milk is fine and the baby's gaining, and then you can wean off that amount of supplementation. What you have to be really careful of is that you're not supplementing with like 2 ounces after every feeding, 2 ounces after every feeding, because what that's going to do is completely decrease your milk supply. When we do see those situations, we're talking about half an ounce, a little bit of extra calories to supplement what they're actually getting at the breast. Yeah. Okay, so that was the first part of the question. The second part of the question was about weight gain, right? Yeah. You know, again, babies go through growth spurts. They don't gain consistently from day to day. So if you weigh the baby at the beginning of the week and then you weigh at the end of the week, they're going to fluctuate during that week. They're going to go up and down. What if the baby like did a huge poop right before they weighed the baby? That's going to be a few ounces right there. It's just
probably felt nice.
Yeah, it felt.
That baby probably feels relaxed.
Probably feel good. But you know, it's going to change their weight when we're looking at ounces. Okay, on a scale, and we're looking like from Monday to Friday. You're going to see differences. So you really can't just, I don't recommend weighing too often. I think that the most important thing is to be watching your baby's wet diapers, making sure that they're peeing, they're pooping, and really just leave the weighing to more infrequently.
Yeah.
And some babies are just small.
Yeah.
These growth charts and the whole idea of like they have to gain a certain amount of weight.
Everyone is different.
Everyone's different. Yeah.
Yeah. This is similar-ish. I need some advice. My left breast has started to produce little to nothing. Righty has been strong for both, but now started to follow suit. Pediatrician recommends supplementing with formula. Midwife suggests domperidone. I feel so awful. I nursed my first 2 till 16 months, and with my little guy, I'm only 3 weeks in. Hard not to feel like a failure. What can I do? I still offer both breasts, but he gets so mad, and I can tell he is still hungry. I cry a mess giving him formula, but he needs to eat. What can I do?
Well, the decrease in supply could be caused by so many different things. It's hard to answer that question with just one answer. You know, there's things that can cause a decrease in supply. There can be things like thyroid issues going on, so hormonal imbalances that need to be checked to make sure that you're, you know, unfortunately going right to supplement with formula is not the answer. We need to identify what's causing you to have a decrease in this milk supply. Is your latch okay? You know, have you seen a lactation consultant? I heard you mention a midwife. I was a midwife for many years. Did I know how to properly latch a baby? Some midwives do, but I could tell you right now, they don't get the formal training in this. So if you're not seeing a board-certified lactation consultant, now's the time to do that. If you're having issues with your baby, if you're having issues with milk supply, one of the biggest causes is an improper latch onto the breast, because it's supply and demand. So if the baby's not latching well, then the milk's not coming out, and then day after day of that, your supply is just naturally going down. Your breasts are actually doing what they're supposed to do. So that could be an issue. The other thing is, are you taking any medications? Things like, you know, antihistamines. It's allergy season right now. You know, things like that, decongestants, antihistamines. If, you know, they'll tell you, yeah, that's fine. You can take it while you're breastfeeding, and it is fine. Except that it will decrease your milk supply down to nothing. So maybe no one's telling you that, and no one's even identifying that could be the issue. And the third thing is, you know, we talk, and we'll talk a little bit about it, we can tonight, we talk about eating and food. And for most moms, it's not an issue that they're getting enough calories while they're breastfeeding, because you have all those extra fat stores that you probably built up while you were pregnant, and you don't need to necessarily eat more. But for some moms who have a really high metabolism, where they don't have a lot of fat stores, where they're they may not be eating enough, and if you're not eating enough calories, that could impact your milk supply. That was a lot.
There's that. Kaylee Said, Shari, there's a chance my son may be born earlier than planned. Right now I'm at 31 weeks and trying to hold him in until 37 weeks at least. Do you happen to have any tips for NICU mamas? I don't really know of any around here that went through pumping and everything for a preemie, and I want to be able to BF like I did with my daughter. First off, I want to say, if you think you might be having a preemie, if it's something that you can foretell, go on Amazon and order this book called The Preemie Primer. A doctor named Jen Gunter wrote it, and I have a copy of it. I've read it, and it's incredible. I think it's a very good read for anybody who may be in that position. It's a very, very, very smart book. Yeah. Your turn.
It's so difficult. It's so hard for moms with preemies because you're separated from the baby. The baby could be in the NICU, and those babies need breast milk more than anybody. What Jamie just recommended is perfect, which is first, get educated. If you think, lots of times people don't know that they're going to deliver early, and it can kind of get caught off guard. If you already have that idea, you're either high risk or you're carrying multiples or something that could put you at risk for delivering early, get prepared either by reading, doing some research that way, getting involved in some online groups, or talking to other preemie moms. There are ways to do. There are places online that you can do that, and mainly making sure that you have a really good double electric breast pump. When we talk about hospital grade pumps, not all hospital grade pumps are necessarily the same.
And hospital grade technically isn't even really recognized by the FDA. So.
Hospital grade pump means that the pump can be used by multiple moms, multiple people. That's really the only requirement. So you want to just make sure that you have a pump, and we'll talk about the pump in a little while, but not necessarily just the pump we're going to discuss, but the features of a pump, to make sure that your pump is functioning well, to make sure that you're not getting some used pump, that you have one that's a double electric pump that has adjustable speed and suction controls, ways that you're going to be able to maintain your milk supply. First, establish a supply, because you may have a preemie that can't actually latch in the beginning. So you're establishing your milk with it, and then maintaining your milk till the point where your baby can actually latch. I think the other important part is to make sure that you discuss this with your obstetrician and also the hospital staff, the NICU nurses. They're fantastic usually with this, and to really just express your wishes so that you have as much skin-to-skin contact with the baby if possible, and you're with the baby as much as you can be.
There we go. Okay, this is interesting, and it could also tie into actually going over the pump. Shari, I am completely stumped and heartbroken. My little bug is 8 months old, and I have struggled to pump since day one. I've spoken to my pump company and my lactation consultant, and I'm not getting a good output. It is literally all over the place with little to no difference in my routine from day to day. Yesterday, I managed the most in a long time at 8.5 ounces during my shift. Today, after taking 3 breaks already and only half through my shift, I have not even managed 3 ounces. Any help or ideas? I will be hiding under the table crying.
No.
Don't hide under the table and cry.
Don't.
No.
But it is so depressing because, you're trying, it's, one of the things that we struggle here, especially in this country, and Jamie and I just talked about this, right?
Yep.
Is how difficult it is for moms, especially in the United States, because so many of us have to go back to work and we're separated from our babies, and under the gun to pump, you have 20 minutes, you got to get the milk out, and you really need to be able to relax to do that. And it's like the worst, it's just the worst conditions for it. So I'm really sorry that it is that situation, but we try to make it easier by eliminating certain problems. When she talks about 8.5 ounces through her shift, that might actually be an adequate amount for her to be able to get out with her pump. The pump's never going to be able to get out as much as the baby. So say she's getting doing 3 pumping sessions during her 8-hour shift, and she's getting somewhere around 2.5 to 3 ounces out per feeding. That's 8.5 ounces right there. So it actually could be just a perception issue of thinking that you need to have more milk when you're really making enough. The idea that some days she's making less, could have there could be so many different factors. If you're getting your period again, so a lot of moms don't get their period while they're breastfeeding, and then a lot of moms start their period while they're breastfeeding. And those days during your period or right before, when your hormone levels are fluctuating and the estrogen is high, you can see big decreases in the amount of your milk supply. Things you can do for that, fenugreek. There are tinctures like More Milk Plus. There's teas like Milkmaid tea that you can drink that can help to, and especially if like you're about to get your period, this could be a good time to just start taking it. And the last thing is, if you see on those days where your milk supply is low, think about pumping an extra feeding when you're home. Sometimes trying to get that extra milk when you're at work, it's just impossible. Like, I don't even like to tell moms, well, try to pump an extra session at work, because it's just so unrealistic. Like, are you really going to be able to take that extra time? No. Okay, so maybe you set your alarm and you wake up once during the night, especially because your milk supply is usually greatest at night. Wake up for 10-15 minutes and pump a little bit extra during the night and go back to sleep. There's that extra milk that you have that you need, that you maybe need to catch up from during the day when you're at work. Or right before you leave for work, feed your baby again one extra time right before you drop the baby off. If you're dropping the baby off at daycare or you're leaving and somebody's watching the baby, nurse one more time. That's going to get that extra milk into the baby that you won't need to supply from pumping. There was one more thing I was going to say that I don't remember. Glad I'm not drinking the wine right now.
I saw something on here, and they all go so quickly.
Yes.
But first off, this was a question from a dad who is watching, and that's awesome.
We like dads.
Jerry just popped up again. Jerry was asking about reusing milk because he uses the milk that his wife worked so hard to pump out.
Awesome.
Yay. What is the rule with, like, the baby drinks some of the bottle but not all of it?
Yeah, this gets into the realm of the differences between breast milk and formula, and storage, handling, feeding of breast milk and formula. They're completely different. So whatever you read about how to handle and store formula, it doesn't apply to breast milk. If you, like, for example, one example, and I think this is probably what he's referring to, is like if the baby drinks from the bottle and doesn't finish the whole bottle, do you have to throw the rest away, or can you save it?
Yeah.
Okay, if it's formula, once the baby drinks from the bottle, whatever's left in the bottle after the feeding's done cannot be saved for the next feeding. It has to be tossed away. But with breast milk, no, you can put that milk aside, put it back in the refrigerator, and you can save it for the next feeding. It's absolutely not ruined, and you don't want to dump the breast milk.
No.
You always kind of err on the side that the breast milk is fine. The breast milk is living, it's alive, it's got antibodies in it. It's very hard to make it go bad. It stores for long periods of time. It can be out at room temperature for up to 8 hours, after you pump it. So if you pump during the night, you don't have to go running to the refrigerator. You could just leave it there on your night table, put it into the refrigerator in the morning, and it's fine. Formula is completely different than that. Breast milk can be in the refrigerator for up to a week, and it's still okay. Formula, you can't do that with.
No.
So, and same with like cleaning and washing your bottles and parts. You don't want to keep sterilizing and boiling your pump parts. You definitely want to do that and follow the manufacturer's instructions for the first time that you take it out of the box, right? You're going to like sterilize it, but then you don't want to keep on boiling those parts.
Luckily, we do not live in a country with like horrifying water supplies and whatnot, so you don't need to sterilize over and over and over.
No.
Just good old soap and water.
It's actually worse because you're breaking down the plastic, which you don't want to do. You don't want to break down that plastic. The parts start to warp and the plastic starts to break down. So you just hot soapy water into the dishwasher, totally fine. With formula, you do want to do more sterilization.
Hope that helped.
Yay.
How much? This is kind of similar as well. She has a question. How much does breast milk last after you defrost it?
That's after the breast milk's been frozen and then it's defrosted, you need to use it within 24 hours. So at that point, yes, it does have to be tossed if 24 hours goes by, which is one of the reasons why when you're storing your frozen milk, I always recommend storing in different size amounts. So like store some like 3 ounce, 4 ounce,
you talked about
store
this.
some 2 ounce, store some 1 ounce, so that you have different sizes. So say the baby eats a 3 ounce bottle and then wants a little bit more, you don't have to defrost it a whole other 3 ounces. You have some 1 ounce or 2 ounce bags defrosted, so that you're not having to use it up. Just a little trick. It's a hack, right? Is that what you call it?
Yeah, a hack. I just heard a noise and I thought it was thunder.
That was Lucky growling.
Oh my god. Okay.
You're getting thanks for the good info.
Oh, I'm so glad you guys are enjoying this. I miss doing this, and I miss
it's
being
been
here
too long.
doing this together.
Weird. No. It all just went a little.
Oh, Joe brought the baby. Should we do the burping so you could just see?
Oh yeah, there's a baby doll here.
Okay. All right, so not a dog, but a baby. Okay.
Yeah.
This is not Angry Baby. This baby's a little happier. Slightly. Okay.
I think my son is precious.
I miss that Angry Baby though. Okay, so when I was talking before about burping a baby, everybody knows burping like this, where you're patting the baby or the baby's over your shoulder. What I'm talking about is holding the baby under the chin this way and sliding a pinky under their arm so that you're kind of stabilizing their neck and their back, and then holding the baby's butt this way and moving up and down in a gentle motion. I'm not talking about shaking the baby. I'm just talking about gentle moving up and down, and enough where they can feel it. So it's not this little tiny. Ooh.
Well, I'm doing it on an iPad, and I have it upside down.
Oh.
I'm turning the volume. No, I'm turning the volume down. I'm good. I'm good.
Okay.
I'm good.
So you're kind of moving the baby up and down, up and down, up and down like this. And again, like we were talking about, if the baby's screaming during this, if the baby's screaming while you're doing this, shushing in their ear. Shh. Loud enough so they can hear you. If they're screaming louder than you're shushing and they can't hear your shush, they're not going to stop screaming. So moving enough that they can feel it and shushing loud enough so they can hear it, and that should get them to stop crying long enough just to get a burp out, and then back to feeding again, okay? If the baby's too heavy, because after a little while, you can imagine you're going to get some, biceps from doing
work on
this,
those
okay?
guns.
This could be heavy. One of the things you can do, you want to have some pressure on the baby's diaphragm. So when you look at my hand here, my hand is on the baby's diaphragm. One of the things you can do is get the baby up over your shoulder, but high enough where the baby's diaphragm is up on your shoulder, and then moving the baby up and down like this, and that kind of creates the same effect. And you can still shh this way without having to use your arm strength, because you may not feel strong enough to do that. Thank you, baby. Should we talk about...
Yeah, the pump.
We could talk about the pump, or we could talk about milk amounts, or
We can. Oh, do you have
belly
the belly balls
I
over
do.
there? Let's get the belly balls out.
This is always good.
All right.
This is always good. Okay, so let's talk about how much milk does a milk jug have? Okay, how much milk do you actually make? Because, like we were talking about before, that the majority of time when people think they're not making enough milk or they have some milk supply issue, the majority of those milk supply issues are not real milk supply issues, although there are some. Most of them are perception issues or misunderstanding or misinformation about how much milk you're actually supposed to be making. And especially in those first couple of days. And in my online class, the one we were talking about earlier, the Simply Breastfeeding class, this is a huge part of my class because I'm trying to get you ready for the delivery, for those first few days when there's a lot of pressure sometimes in the hospital from the staff, from the nurses, from everybody. The baby's not getting enough, the baby's not latching, the baby's sleeping all the time. And so I think it's really important to see a visual, to see exactly how much are you actually making and how much is the baby supposed to be eating, because it's really not that much. when a baby's first born, their stomach size is super small. And the reason for that is that they're really not supposed to eat that much. They've been swallowing amniotic fluid the whole time that they're in the uterus, and they're born fluid overloaded. Okay, so they're born with more fluid than their bodies actually need, which is why even if they sleep through that first day, they're peeing constantly. How's that happening? Like, where's that coming from? They're peeing because they're peeing out all the extra fluid. And you're not the only one who's not making milk in those first few days. You're making colostrum, which is drops, and it's very important drops that the baby does need, but it's not volume. And you're not the only one. Nobody makes milk for the first few days. So the baby's really, if you think about it logically, nature didn't get it wrong where your baby needs to eat and you're not making milk for the first few days. Okay? The baby's stomach size is super small, and this is a little marble here, and it kind of gives you an idea of how small the baby's stomach is on day 1 of life, okay? And in a bottle, which you won't see it like this, but I'm going to show it to you visually, that's how much, you want to go to a little closer maybe?
Yeah.
Right?
It's hard to see.
That's how much it actually looks like in a bottle, okay?
Oh, there we
You're
go.
talking like about 5 cc's or a teaspoon at a time, and that's per feeding, okay, on day 1. And you know, how much of this do they need? As many times as you can get the baby to latch for a few minutes, they're going to get this amount of colostrum. If the baby won't wake up, then what I usually recommend is just expressing it onto a spoon and pouring it in the baby's mouth and waiting till the next day when they actually wake up. Lots of babies are born very sleepy. Why? Because they really don't need that much to eat. They're not starving, okay? So that's day 1. On day 3, this is the size of a baby's belly on day 3. A little bit bigger. And it's like kind of like a ping pong ball, a little bit smaller than a ping pong ball. And in a bottle, it looks like this. It's about a ½ ounce. Okay, that's per feeding. Per feeding. That's on day 3. That's about like if you know when you're coming home from the hospital, when you're just starting to get the baby to really eat and latch. That's all they're getting for an entire feeding from both breasts if you're feeding from both breasts. Okay, this is pretty shocking for most moms. Because this is not what we're used to seeing.
No.
Okay, this is not what we're used to seeing, like full bottles, formula.
And even giant bottles.
Or giant bottles, which will never happen. So this is about what you will be getting. And the best part about seeing something like this, I think, to me, is the confidence that it builds for breastfeeding moms.
Yeah, it's shocking to me how many women who watch this will be like, I had no idea that's all they're supposed to have. And I didn't know. I mean, when I went to like breastfeeding classes where at the birth education center I worked at, I was like, I came from the retail side of it. It was like 4 ounces at least done because this is what size the bottle is. Yeah. But then you're like, oh, hell no, their tummies are tiny. And that is all they should be having. That's all they should be having. Yeah.
Now, again, you're not seeing this. We're demonstrating it in a bottle because this is not how you're going to see it, but it's more to just give you the confidence that the baby's getting what the baby needs. It's just such a small amount, and what you're watching are different things than how much is going in because you can't measure that. You're watching how much is coming out. So the baby's wet diapers, listening for swallows, making sure your latch is well. All those other things are going to be way more important. And so volume and yet it seems to be the biggest concern is, am I going to make enough milk? Am I going to make, and that's the adequacy thing of like, am I good enough? Am I enough? And this is enough. This is enough. Yeah. Okay, so that's day 3. On day 10, baby's stomach size is about that. And that's like one of those little
plastic eggs. They come with a toy.
Yeah, okay. That's the size of baby's belly on day 10. And what that looks like in a bottle is that. And that's about 1.5 ounces. An ounce and a half is really, again, not that much. 1.5 ounces, 2 ounces. That's the entire feeding. And we're talking like every 2 to 3 hours. That's a normal amount. 2 ounces every 2 hours. Great feeding.
Oh, Jamie just said, then why did the NICU force feed him 2 ounces at every feeding while he was there?
Overfeeding.
That's 2 ounces for a preemie is a whole hell of a lot.
And again, I don't know how old was the baby.
Yeah.
So preemies can be in there for a while. we're talking about day 10, day 3,
Yeah.
day 1. Okay, so this is like the beginning. So, it depends. But yeah, remember with a bottle, you can really overfeed a baby. When a baby's feeding at the breast, you can't force them to eat more. And any nursing mom will tell you that once the baby's done eating, you can't get them to suck and eat more than what they want.
Yeah.
So they self-regulate that. I mean, you don't know how much they're eating. They eat till they're done, and then they take themselves off, or they stop, or they still suck, but they're not actually eating. It's like just sucking, and there's a difference. So that's day 10. And then I'm going to show you what a full feeding is. So somewhere, this is a 4-ounce bottle. Okay, there's 4 ounces inside this little bottle here.
Which you can see easily.
Okay, that's an entire feeding, and sometimes more than they'll actually take. Like 3 to 4 ounces is a full feeding for a breastfed baby.
Mm-hmm.
And I don't mean just like at 2 months old, or 4 months old, or 6 months old, or 8 months old. I mean like the whole time that you're breastfeeding, that's a full feeding. Okay, it doesn't continue to increase as the baby gets older, where you have to keep making more and more and more. In fact, you're making less and less and less as the year goes on and the baby starts to eat solid foods. Okay, so or imagine how big your breast would be. You'd be so full. And so the concern happens when moms go, well, my baby is 6 weeks old or 2 months old, and I'm doing this now, but how am I ever going to get the 8 ounces when they hit that point?
That is what is so interesting. I mean, the education is not there versus what breast milk babies eat versus what formula babies eat.
Completely.
And it is like you see this giant 8-ounce bottle you got at the store and like whatever, and they're like, I only have 3 ounces in this.
Yeah.
That's not enough.
Yeah.
And like it's a very different.
And when we talk about like the differences between breast milk and formula, and we see why is it important to teach about breastfeeding? Why do we talk about breastfeeding? There is so much information out there or visuals out there of formula. There's not enough of what we're seeing here. And that's why it's important to see this, because it will create a lack of confidence in a mom who is breastfeeding, who then could give up on breastfeeding when they really didn't need to, or think their baby needs more because the baby's crying, which babies cry for lots of different reasons, not just hunger. So it's a really important conversation to have. And I, when I talk to breastfeeding moms, I usually don't recommend them getting any larger bottles. You don't really need the 8-9 ounce bottles because you're never really going to use them if you're going to just.
We just had some Emily. She just said that she's crying right now. She feels so much better because she was worried she was only getting 3 ounces and she was worried that wasn't enough.
That's why we do this. That's why we do this.
There you go.
I'm so glad to hear that. You're more than enough, Emily.
Yep.
More than enough, and you're doing an awesome job.
Speaking of more than enough, Joe.
What an awesome thing. That's so great. I'm so happy to hear that.
Oh, here we go. I was not ready for that. I'm good. Thank you. Let's see here. There, went back. iPad, why are you being sassy to me? Let's get a question off the screen really quick. You're like, wine boy over here.
Wine boy.
Okay, here we go.
Joe, you want to say hi so everybody can see you? You're on these every single time. We never get to meet Joe.
Oh.
He's not wine boy.
He's not wine boy.
He's not actually
Joe.
wine boy. Come say hi. Come on, Joe. Joe needs to just at least say hi. Show your face. This is my partner. This is my husband. It's my hubby.
This is Joe.
This is Joe.
Hi, everyone.
So everybody sees Joe in the chat room. They see Joe They see his arm pouring from the side.
Stoking the fire in the winter.
Stoking the fire in the winter.
Working on the fire.
We never get to
Handing
see your
you
face.
lucky. Good.
Handing me lucky. Thank you, Joe.
I'm thinking right now, actually, we've been doing it for an hour right now. The phone is freezing up every now and then.
Oh.
So let's just go ahead.
Is my kid on the internet over
I
there?
don't know. It's the phone. Sometimes Facebook is just a mess. So we are going to shut this off, and we will come right back with round 2 of this, where we will just be taking questions off the screen. That work for you?
It definitely works.
High five.
Good job.
Stop my baby from biting.